And are you using both are you recommending that everyone be on vaginal estrogen therapy, and then even if they start systemic, that they stay on both?
Yeah, it's a great question. And this came up when we developed the GSM guidelines. And my favorite statement is number 11. It is the one I'm most proud of. And it says, for patients on systemic hormone therapy, we should be screening and treating the genital and urinary symptoms of menopause. And so what we find, and we don't have this data so clear cut, we have a lot of what I'll call vibes and spidey sense of that many people who use a patch, an oral estrogen, any kind of systemic therapy, it's not enough for the vaginal and the bladder symptoms. So they're still going to have frequency, urgency, leakage, UTIs, pain with sex, and adding a vaginal product is adding no risk, no danger, nothing scary. So when I say, what are you afraid of? Don't be afraid of having someone on a patch and a vaginal product at the same time. It's not scary, and it's now in the guidelines to support you. So I'm very proud of that guideline statement. Now, again, back to that patient, where I would be crystal clear, and I want to clarify is, again, what are her goals and what brought her to my office? What is the thing that is just so distressing to her? Because if she's hot flash and has no genital and urinary symptoms, I'm not going to start with a vaginal hormone and say, okay, we got to do this for 3 months. I'm going to start with a systemic hormone product. If she comes to me, she's got everything, and she needs some education, I'll probably do education in vaginal hormones and then bring her back to start the systemic hormone therapy in a stepwise fashion. I have found, and this is sort of my gray hair, there's a lot of it if you look up close, my experience is when you give a person all 5 things that we sometimes give for menopause hormone therapy, they go home and they just can't figure it out, and they don't know how to do it, and they get nervous, and they kind of always end up coming back and like starting slow. I do think a stepwise approach, because you as a prescriber, you need to know what your medicines are doing as you're getting comfortable doing this. And what I encourage you to do is don't give hormone therapy prescriptions and say, I'll see you at your next annual in a year, because that is not good for your brain as the prescriber. You need to know what these are doing, because you need that positive reinforcement to say, oh, wow, she really is sleeping better. Oh my gosh, sure, her joint pain really is gone. That's amazing. And then it gets your brain realizing that all those patients, that you're also seeing that week, that maybe there is a conversation to be had.